right, what's up, guys? Dr. Dan.
Dr. Emily.
We're gonna exchange some adjustments. So we're just gonna roll with the camera, and we just got Dr. Emily adjusted on Monday or Tuesday this week.
Yeah.
So we shouldn't have too much to work on. Upper right side neck. She feels that little point right there. So we're gonna do a little muscle work around the suboccipitals, and you guys see when now with a tank top on some of the other videos, you can't tell with the t-shirts, but you can see how I can pump that glenohumeral joint. And it feels a little funky, doesn't it?
Yeah, a little creaky.
A little creaky, but good to just loosen up that glenohumeral joint with a little bit of movement like this.
From throwing a softball like a turd.
Like a turd?
Just trying to whip it as
Is
hard
that
as
what you said, like a turd?
Yeah, like a turd.
Don't throw a softball like a turd.
Don't do that. You'll jack up your body.
Yeah. Throw it with locomotive fluidity.
And practice throwing with both hands.
Practice throwing with both hands. True. Dominant and non-dominant side training is something that we've done for, 3 years now over in the gym. For the soccer players and baseball players. Soccer players, we found a lot of right side dominant leg issues just from like kicking the soccer ball with the inside of the right toe and causing repetitive, toe out, knee in injuries. If you're a baseball player and you're throwing right-handed all the time, a great way to kind of balance your body out is just practice throwing left-handed. It'll balance out your scapular movement, and it will activate the oblique system and the core muscles and allow your spine to rotate in different patterns, which just makes our job easier as chiropractors to get you adjusted a little easier. Look down for me. Look up. Look down. Look up. Look down. Look up. Look down. And up. And down. One more time up. Down. Good. And let's do left side.
Guess what I got him for his birthday?
What's that?
Omega Hypo.
All right. We can put this on YouTube. Dr. Emily's dad's birthday. She got her father Omega Hypo, which is what we call a functional birthday gift. It is a gift that will benefit his health.
Make his joints feel better. I just hope he actually takes it.
Yeah. Supplements are an important part of a healthcare program. Diet is number one. Exercise and movement is number one. And then you get into your accessories, which can be supplements to assist in, additional nutrient deficiencies. Most of us, myself included, Dr. Emily, probably, I don't eat enough fish throughout the week or throughout the month, really. I kind of don't like fish, so I'd rather just take a couple fish oils, 1 to 3 fish oils every day. I don't feel in my body that I have a lot of inflammation, so I don't need to take a high dose. But some people that have a lot of, arthritis and cardiovascular issues and potential metabolic issues, we might put on a higher dose of an omega-3. And what we're feeling, how's that guy feel?
So tight.
So we know Dr. Emily's right shoulder is a little more sticky than the left side. And right now we're down. This is her scapula. It's the triangular bone in the shoulder. We have this little ledge right here. It's called the spine of the scapula. We have the supraspinatus that sits up here and the infraspinatus that sits down here. The infraspinatus is a lovely muscle that will accumulate neurological dysfunction, muscular dysfunction. Sometimes we get some wicked trigger points that can feel like a toothache.
I feel it in my pinky.
Oh, the whole way down. So she feels in her pinky. That's called a referral pattern. And a referral pattern is amazing because you can have pain the whole way down in your finger that doesn't even come from your finger. It comes from your right scapula. The body is just amazing at how the neurological system, the nerves are connected from your brain down to different body parts and from muscles down to different body parts. So when I press in this big trigger point that she's got right here. And I'm just kind of maneuvering my thumb over it, just light, slow movement, trying to find the center of it, which is probably like right there-ish, somewhere right there. And this pain, she says, and I'm not even pressing hard. This is like moderate pressure. But she says, this pain radiates the whole way down to my pinky finger. Okay, so here's what we're going to do. We can do some hands-on myofascial release, or we can just blast this thing out with the hypervolt a little bit. Stretch your head over to the left, and then lower this right shoulder down, like that. Look chin to chest. And now when I have her just position her neck in different positions, it's just creating a little bit more myofascial tension, kind of pulling and manipulating or moving the muscle and the connective tissue underneath her skin. It helps open the muscle fibers up a little bit. So you can just get a little treatment with the hypervolt around the inferior or the lower portion of the scapula. Okay, so not much, just a little bit into the shoulder. And that generally is just going to help to improve that range of motion of the glenohumeral joint a little more. Now, there's a ton of different rehab exercises and shoulder exercises to really help, whether we want to contract, go palms up for me and thumbs out for me, right? Whether we want to just activate the infraspinatus, which is an external rotator, and really just kind of have her hone in, put your brain in your thumb, and roll this guy open, and you can kind of pull your head, and you'll see this band pop out right here, guys, and she'll feel this tension. We're getting her to access her deep posterior musculature on her right scapula, right tricep. She's going to pull some of the front chain tension out. This is going to open up the neck and reduce nerve tension, joint and nerve tension around the cervical spine. She knows she's got this little right side C1, C2, C3 restriction up here that we're going to adjust today. Okay, but nice, so easy, open exercise, palms up, neck stretch, left and neck stretch, right. Okay, let's go face down too. All right, now Dr. Emily is an athlete. She runs, she moves, so awesome. If you're not subscribed to her on Instagram yet, check her out. Dr.
M. Brady. Oh yeah, underscore, yeah.
Dr._M. Brady. And she posts awesome videos on her Instagram. I'm running 2 Instagrams now, at Dr. Dan's Plan, which is a little more my personal one, and then at Go to Chiro, which is where we're going to start posting some adjustment videos on Instagram and some different stretches and more healthcare related tips. Okay, so we're going to use a little hypervolt around her hip. And we're going to tell Dr. Emily just to focus on a nice nasal breath in, a deep breath in, down deep into your lungs. Gently feel your abdomen push down into the table, and then exhale slowly. So as we treat the body, as we work on the body with the hypervolt or with muscle work or with adjustments, we want to help activate the deep core and reduce the extraskeletal muscle tension. When you activate your deep core with diaphragmatic breathing, it helps to take you out of that fight or flight, sympathetic overdrive, and helps you to relax your tightened up muscles a little bit. If you're ever getting a massage, if you've ever had a massage and that massage therapist really presses into a tightened up area or painful area, and you go into that hurts, and you kind of tighten your whole body up, that fight or flight response is not going to help those muscles to relax. Conscious activation of the parasympathetic nervous system, the rest and digest nervous system, is done primarily, what I like, through diaphragmatic breathing, deep diaphragmatic breathing down into the abdomen. So, Dr. Emily, like all of us, get a little jammed up down in the SI joints with correct stretching and hip placement and knee movement as she walks and runs. this tension will dissipate. It will go away. But if you don't stretch, bend, twist, move, walk, run correctly for a couple days at a time, you can start to feel your low back will just kind of tighten up a little bit. Our bodies are made to move. They're made to move through a full range of motion every single day of our whole life, which is a lot of days and a lot of years.
My hip released when you were hyper holding it.
Did it adjust?
Yeah.
Yeah? See, I didn't even hear it. So there's a lot of different terms when we talk about adjustments. Some chiropractors say we have to align your spine, or we have to adjust your bones, or we have to put your bone back into place. That's like the old school saying.
Correct the subluxation.
Correct the subluxation. In our office, we don't say subluxation.
Yeah.
I don't say subluxation. Chiropractors say subluxation. Subluxations can lead to all kinds of disease. The philosophy of chiropractic was that subluxation, which means a crooked vertebrae, can cause a whole host of health conditions, whether it's irritable bowel syndrome or irregular digestion, or late stage cancer. Lots of chiropractors back in the day said if you don't get adjusted all the time, you set yourself up for more organ related issues or potentially cancer. Now, we don't know if that's true or not because there's no research over 120 years that ever shows or proves that, but it's also, I don't think, ever been completed long term. Healthcare is kind of funny because everybody wants, backed scientific studies. And there's so many different kinds of chiropractors and different techniques, and it's just impossible unless we get a whole institution that starts studying every different kind of chiropractor. I don't know if we'll ever have research on it all. Right? Do you have anything?
Not until colleges will pay for research. That's what medical doctors work at colleges that pay for their research.
So I got paid research. All I know is that when you get adjusted, when we teach you how to move well, you feel amazing and your body heals and your mobility improves. You feel more energized. You sleep better. You move better. You eliminate non-contact injury and pain. And that's the ultimate goal. My ultimate goal for each of my clients, and Dr. Emily's, I think, is the same, is to just keep you guys moving until you're 80 or 90 or 100 years old and avoid arthritis and avoid disc degeneration and disc herniation.
Yeah. So we tell it like it is. You're all twisted.
That's it. It's simple.
You're all twisted.
If you got pain, your body's twisted up. Take a deep breath in. Exhale out. Deep breath in. Exhale out. Deep breath in. Exhale out. All right. Awesome. Face me over here, left side. And that's a good point. Lots of people, we have all these diagnoses, right? Diagnoses. So if you have shoulder pain, your diagnosis might be a strained rotator cuff muscle. It might be subacromial bursitis. It might be bicipital tendonitis. You might have a injury to your labrum.
But people get all hung up on their diagnosis.
What's my diagnosis?
And then they think that they're gonna have that pain for the rest of their life.
Yeah. I have bursitis in my shoulder. Okay.
Yeah.
Great. You have dysfunction in your shoulder. Your shoulder doesn't move as well as your left shoulder does, maybe. Maybe your spine's crooked.
Yes. But it doesn't mean you have to have bursitis for the rest of your life.
Nope. You just gotta stretch it. Maybe get adjusted a couple times. Maybe 10 times. Maybe you're really stiff and we gotta work for a month or 2 months or 3 months. All right. So some of our patients come in here and they're like, I've never been adjusted, but I got neck pain or shoulder pain or something. And some patients, they're just emotionally de-stressed. They don't have a lot of internal tension. Maybe they eat pretty clean. Maybe they exercise daily. And we might see them on their first appointment and they adjust beautifully. Their neck adjusts, their mid-back, their shoulders adjust, and they just instantly feel better because we reduce the restrictions throughout their body. And some people have lots of stress.
Whether it's emotional, nutritional.
Now, not yet. We've been working on Dr. Emily's elbows.
Yeah. They're all jacked up.
They're all jacked up. Oh, that guy's getting closer. All right. It's close. It's moving. It's pumping. So what we're feeling for, we're feeling with adjustments, we kind of tension a joint out to its end range. And then we just want to push it just a little further to help get that cavitation or that release out of the joint. Beautiful.
Nice.
Sit up tall. Money, money. That's it.
Ooh.
We did ankles, knees, really flexible. She's super flexible. She's got a mega healthy body. Her adjustments, cervical spine adjusted really well. She was a little restricted up in the right side of her neck. We adjusted upper cervical spine in the right, mid cervical spine in the left, down through her thoracic spine. Lumbar adjustments were awesome.
Mm-hmm. Yeah.
Elbow's still a little tight, so she knows her rehab. Let's listen to this, guys. Let's see if I can. All right. So there goes my elbow into external rotation with a simple self-adjustment. And Dr. Emily's working on this as well. It's a little blocked isometric hold into the elbow that really allows us to kind of activate the external rotation system of the bicep, the forearm, way back into the middle back muscles. And she's got a little bit more work to work on her external rotation here, and then we'll start to get her elbows to adjust really nice, which is an amazing feeling. So cool.
Yeah. Yes, thank you.
All right. See you guys later.